thank you everybody for joining us today. And I'm going to introduce some community partners here in just a few minutes that are really helping us in our community be a national leader in many regards when it comes to helping those in our community that are most vulnerable, those who are hungry, those who are suffering with severe mental health issues, and just generally making Albuquerque a place that other cities are now looking to help solve issues, solve problems, meet challenges. But also today we're going to talk about the need to do even more, and that's what this press conference is about today. I'm going to introduce, as I said earlier, some of the partners in just a minute, but today what we're going to talk about, as I said earlier, is the fact that Albuquerque is really taking a leading role in combating homelessness, mental health issues, and food insecurity over the past several years, but also before that. There's folks up here today standing with me that have been working on some of these issues for decades. And we know that we do well in regards to many of these services, but we know there's more work to be done in the city of Albuquerque. So today we're announcing that the city is going to be awarding 6 new contracts worth over $2 million to 5 local nonprofits who are with us today to help those in our community, additionally who are homeless, who have mental health issues and who are living in mental health crisis, and who face food insecurity on a daily basis. Some of the partners that I have joining me today are Albuquerque Heading Home. We know Dennis Plummer. We have St. Martin's Hospitality Center. Father Rusty is with us today. Healthcare for the Homeless, Jenny Metzler is with us today. Roadrunner Food Bank, Melody Wattenbarger is with us today. She runs that program. Noonday Ministries, Dan Watley is with us here this afternoon. Members from Creating Community Solutions on Mental Health are joining us today. And also First Nations Community Health Source, Don Begay. We've got other advocates in the room today and other nonprofits that are really doing great work out there in the community. So this $2 million, it's actually $2.05 million that we'll be awarding in contracts. We're going to be spending that in a number of different areas that we think are significant and important. $930,000 of the funding will assist 3 public facility improvement projects that will enhance access, acquisition, and distribution of healthy food for persons in our community experiencing homelessness or persons at risk for experiencing homelessness. Those 3 projects include St. Martin's, who will be receiving $350,000 to renovate their day shelter and improve their kitchen and their dining facilities to expand their capacity to serve 600 people per day. Currently, I think, Rusty, you're at a 350 person capacity. So that's almost doubling the capacity for St. Martin's for feeding the homeless. First Nations Community Health Source will receive $320,000 to renovate their facility to provide food services to 2,500 persons in our community. And Roadrunner Food Bank will receive $260,000 to be used towards some roof repairs on their warehouse project. And that's important for a couple of reasons. It's important because the community and the state are very generous with food donations, but if the roof's leaking and the food's getting damaged, that really limits what the food can be used for. Out of the $2.05 million, $625,000 of the funding will go to St. Martin's Hospitality Center to provide housing and case management services to an additional 60 homeless individuals who are living with severe mental health issues in our community. These funds are in addition to the current funding of $1.8 million that go to St. Martin's for permanent supportive and transitional housing, displaced tenants and motel voucher assistance, and outreach and neighborhood cleanup services, and day shelter and meal services. Of the $2 million, additionally $500,000 will go to Albuquerque Healthcare for the Homeless and Supportive Housing Coalition to provide stable housing and case management for an additional 30 individuals who are homeless in our community. So those 2 alone are an additional 90 individuals that we will be helping get the mental health services that they need and get into permanent transitional housing. That's on top of the 430 plus people that we've been able to house through Albuquerque Heading Home in the last several years. These folks, as you know, are the most medically vulnerable, the most likely to die in the streets of Albuquerque. So we're expanding those services as well. So each year in the city of Albuquerque, in this last year's budget, we had a little over $14.5 million in services that we call wraparound services for individuals living in our community experiencing homelessness or living with mental health or substance abuse issues. That's over $65 million in the last 5 years alone. And those wraparound services for persons experiencing homelessness, some of our partners are here with us today. Healthcare for the homeless, that's dental, medical, substance abuse programs. Family services such as PB&J, Catholic Charities, Title I, schools, etc. Shelters, including day, night, women's and children's and teen shelters in the city of Albuquerque. Pastor Hill is here with us from the Rescue Mission. They run our winter shelter, among doing other great things in our community. Mental health services are part of that $65 million. That's UNM Mental Health Services. St. Martin's does a wonderful job also with that. Substance abuse services such as Al-Anon, AA, Crossroads for Women, Salvation Army, etc. provide those services. Free meal sites such as the First United Methodist, Brothers of the Good Shepherd, Noonday Ministries, Albuquerque Rescue Mission, and others that provide meals for the homeless. Youth services include CASA Q, UNM ASAP, Youth Development, YDI, and others. Veteran services include healthcare for the homeless in Albuquerque Heading Home, along with the work that the VA is doing in our community. Emergency hotline numbers such as Agora Crisis Center, the Rape Crisis Center, Child Abuse and Neglect, Domestic Violence hotlines, and others. And there's 52 other services that really make part of that $14.6 million. So by working with our community partners in the city, I believe that we're bolstering resources to meet the demand of those who need and want help in our community. We know that we're not finished. We know there's more work to be done, but we want the community to know that it's not just government doing this. The taxpayers, as I said, have put in $65 million over the last 5 years for these kinds of services. Today we're adding more than $2 million more. But it's really these individuals, these nonprofits, these folks that are dedicating their lives to going out each and every day and making life better for those in need that really touch me as a mayor of a city. And I think it really speaks to our city, that the heart that we have. We have a heart for this in Albuquerque. We have other cities coming in. Anaheim, California came in and adopted our Heading Home program recently. I think in June, the mayor of Lexington, Kentucky, Mayor Gray, has contacted me asking about how we're doing this in the city of Albuquerque, so that we know that other people are looking at us and seeing the great work that these folks are doing. But like I said earlier, we need to continue doing more. And lastly, before we take some questions, I would like to just once again thank my staff. Our Family and Community Services Department, Doug Chaplin is our director, does a wonderful job. We've got Heidi Jordan with us today as well, and Dr. Michael Robertson also, who we met as late as this morning talking about not just this issue today, but what we can do on other issues that are pressing, that are facing our community at this point in time. So I want to thank everybody here that's involved. I know that you will take these resources. I know that you'll put them to really the highest and best use in our community. You will take these dollars, you will leverage them to ease human suffering, and you will do it in a way that returns of value, not just for those who are being helped, but for our community as a whole. So I just want to tell you from the bottom of my heart, thanks for doing the hard work. Thanks for doing the heavy lifting. It matters. It matters to our community, and it puts us in a place where we can tell other cities and other folks around our country, you can do this in your city too, and this is how you can do it. So with that, we'd be happy to. I know we have some press releases, we have some other handouts for the media, but there's folks here that, if you have questions, let's talk about this.
Mayor, I think all the homeless providers here have told me at one point or another that there's a certain segment of the homeless population who simply don't want services. They want to be left alone.
Yeah.
And therein is where the tent city comes in.
Right.
I know that last week I was sent, and I think some of the city councilors, you were also, a proposal from ABQ Justice for their vision of a tent city. So my question is twofold. First, if you've seen the proposal and what you think of it, and secondly, what do you do about the tent city people who simply don't want to plug into the normal services that the providers are offering?
Well, number one, I have seen it. Number two, I have read it, and I was looking at it as late as this morning. We are not finished analyzing it yet, so let me make sure that you understand that we didn't just read it and toss it to the side. I've been on record, and I'll go on record again today, telling you that I don't believe the tent city is a logical solution for the long-term issues that we face in the city of Albuquerque. We have programs that work. We have folks that take these dollars and they leverage them. I'm not willing at this point, and I haven't been convinced at this point by data from around the country, that a tent city or an encampment, as they're commonly called, is the best solution. And so I'm reluctant to take resources away from the great work that's being done and the thousands and thousands and thousands of people that are being helped through these programs and diverting those funds into something else at this point in time. I've done a lot of study on this. Traveled as far as, I was in New York City just a couple of weeks ago, meeting with Mayor de Blasio's staff. We're taking this seriously. We're finding out what other cities are doing with encampments. And most cities that I've talked to don't allow encampments because they think that they're not really the best solution, and they're not best for the folks that you're trying to help. Let me read you a couple of quotes, and so it's not just the mayor of Albuquerque saying this. The United States Interagency Council on Homelessness. Okay, so this is a collaborative of many experts in this field on a national level. There's a handout we can send you with today that talks about effective community-based solutions for encampments. A couple of quotes from that report. And I'm going to use the acronym, it's USICH, the Interagency Council on Homelessness, believes that encampments also are not a solution to homelessness. Encampments only offer a temporary and reactive response to homelessness. Encampments also create risk for their inhabitants related to safety, health, and sanitation. And the costs associated with trying to ensure the well-being of people living in encampments can be spent more strategically to create permanent housing and service options. And this is exactly what we found in our city. So we want to continue reaching out. This isn't a matter of us turning a blind eye to the situation. This is a matter of us saying to folks in our community, if the services that are available today, if you're not aware of them, let us help you make you aware of them. If this is something you don't feel comfortable with, let's continue to extend a hand time and time again to try to get you into programs that can help you, whether with homelessness, with mental health issues, with substance abuse issues, some of the things that we call co-occurring situations that people find themselves in. Many times if they have a mental health issue, they might also have a substance abuse issue. But like I say, at this point, I haven't found the research, I haven't found the data to convince me as a mayor that that's the best solution. So yes, I've read the proposal. We'll continue to analyze it, but at this point in time, I haven't found evidence that that's where the city of Albuquerque should go, at least in my opinion as the mayor.
Mayor, what's being done for the people that do not have behavioral health issues or severe mental illness, and they're not leaving jail and they're not on drugs? Because when I went out to Tent City,
Sure.
I spoke with a woman.
Mm-hmm.
She has epilepsy, so she can't work. But
Right.
she doesn't have all those issues, so she said that a lot of the programs she doesn't qualify for, and she said there's a waiting list for housing, and so she's in the tent until she
Right.
can get housed. So what type of permanent housing options are
Well,
there?
this is where Albuquerque Heading Home comes in, and we still have, we know that in the point in time survey will be coming out in the next weeks or so, or maybe in a month, of the survey that we did recently. Dennis and his group will be putting that out. We know that we've been able to reduce the number of chronically homeless, medically vulnerable in our community. It sounds like this lady may be in that category. So if she has a situation where she finds herself medically vulnerable on the streets, this is where we're going to continue ramping up these programs to try to help individuals. There's a place where you have waiting lists, and almost every city has them, almost every program has them, but we think with the multifaceted approaches that we're taking that we can help the most people with the resources that we have. If you have any contact information, I would imagine our folks at the city already have made contact with this individual. We can research that further, but we think that we're providing a broad spectrum of opportunities. So it's not just for those who, as you said earlier, have one specific problem or the other. We know that a lot of folks who find themselves homeless have co-occurring
How come
situations.
the money wasn't designated? Because on here it says for people with severe mental illness
Right.
or behavioral health problems. How come more money wasn't allocated to people who just don't have a home?
Well, because we have to take the resources that we have as a community. These are new resources. These are new programs. Part of this comes from community development block grant money. Part of this comes from our general fund. So last year we bolstered our efforts in this area, and that's why we were able to put these contracts out. I ask our experts. I go to the community, I talk to the folks that work in the city of Albuquerque, and the questions I ask are the same one that you just asked. Where is it that we can put the resources to help the most folks that need the help today? And these were the areas that were identified through Family and Community Services that need additional support. There will always be a gap somewhere. So what we'll try to do is fill those gaps as we see them. We know that Heading Home's done a wonderful job with the chronically homeless, medically vulnerable. We know that we need mental health services in our community. We know we need to feed the homeless. We know that we need to feed the homeless in multiple ways. We need folks to prepare the food like Pastor Hill and Father Rusty do and Noonday does, and show up for a hot meal. We also know that we have folks in our community that simply need a place to go like Roadrunner Food Bank and buy food that they can take with them and prepare for themselves and their family. So once again, it's a resource allocation. It's a long answer, I apologize. But it's a resource allocation situation, and I rely on my experts to tell us where to put the resources to make the largest impact in our community.
What will happen to that tent city that's out there? Like, they say that if the state makes them leave, they're gonna go find another product.
Well, and I've talked about this before. We can't control what some, the folks that are living in Tent City have an advocacy group that they've surrounded themselves with. The advocacy group gave us this proposal for the Tent City. Not only do I not believe, and most experts that I talk to don't believe that's the best solution for these individuals, even the United States Interagency Council on Homelessness don't believe it's the best solution. So all we can do is be reactive if they set up somewhere on private property, which is, not acceptable. They set up on public right-of-ways, which isn't allowed by law. We will continue to go there, and it's not just a matter of giving eviction notices, it's a matter of reaching out, trying to connect them to other services, do what we're doing today, add resources, significant resources to additional programs, and just try to get them the help that they need. But at some point, we're asking folks, and the advocates also in this regard, to come to the table, and some of them have, and continue to work with us so that we can address the situation. But at the end of the day, I just really am concerned for the health and the welfare of the people living in the tent city. I'm really concerned about the neighborhoods that they're occupying, so to speak, and I'm really just concerned that that's not the best and highest use of resources. So we'll just continue to work with them and reach out.